Hello everyone. In this video I'm going to go a little bit over sexual orientation, the development, and basically stuff like the efforts to change sexual orientation through therapy, some different views of it, and including efforts to change sexual orientation through religious ministries. So, this is not going to be a religious bashing video or anything like that. Just want to put that out there first. There's many things in the world that goes against sexual orientations, and some religions just happen to be one of those. So if I left that part out, I would totally just be wrong, because I do try to cover many different aspects of whatever topic it is that I'm covering. So sexual orientation is an enduring emotional, romantic, or sexual attraction that one feels towards men, towards women, or towards both. Although sexual orientation ranges along the continuum, it is generally discussed in terms of heterosexual, which is attraction to the opposite sex, homosexual, which is attraction to the same sex, and bisexual, which is attraction to both sexes. Sexual orientation has not been conclusively found to be determined by any particular factor or factors, and the timing of the emergence, recognition, and expression of one's sexual orientation varies among individuals. Sexual orientation is not synonymous with sexual activity. Many adolescents, as well as adults, may identify themselves as lesbian, gay, or bisexual without having had any sexual experience with persons of the same sex. Other young people have had sexual experiences with a person of the same sex, but do not consider themselves lesbian, gay, or even bisexual. This is particularly relevant during adolescence because experimentation and discovery are normal and common during this developmental period. Lesbian, gay, and bisexual adolescents follow developmental pathways that are both similar to and different from those of heterosexual adolescents. All teenagers face certain development challenges, such as developing social skills, thinking about career choices, and fitting into a peer group. Like most heterosexual youth, most lesbian, gay, and bisexual youths are healthy individuals who have significant attachments to and make contributions to their families, peers, schools, and religious institutions. However, lesbian, gay, and bisexual youth must also cope with the prejudice, discrimination, and violence in society, and in some cases in their own families, schools, and communities. Such marginalization negatively affects the health, mental health, and education of those lesbian, gay, and bisexual young people who experience it. For example, in one study, those students were more likely than heterosexual students to report missing school due to fear, being threatened by other students, and having their property damaged at school. The promotion in schools of effort to change sexual orientation by therapy or through religious ministry seems likely to exacerbate the risk of harassment, harm, and fear for these youth. One result of the isolation and lack of support experienced by some lesbian, gay, and bisexual youth is higher rates of emotional distress, suicide attempts, and risky sexual behavior and substance abuse. because their legitimate fear of being harassed or hurt may reduce the willingness of lesbian, gay, and bisexual youth to ask for help. It is important that their school environments be open and accepting so that these young people will feel comfortable sharing their thoughts and concerns, including the option of disclosing their sexual orientation to others. Such disclosure is an expression of a normal tendency to want to share personal information about oneself with important others and should be respected as such. It is healthy for teenagers to share with friends and families their latest crush or how they spent their weekend. To be able to provide an accepting environment, school personnel should need to understand the nature of sexual orientation development and be supportive of healthy development for all youth. If school environments become more positive for lesbian, gay, and bisexual students, it is likely that their differences in health, mental health, and substance abuse risks will decrease. The term reparative therapy and sexual orientation conversion therapy refer to counseling and psychotherapy aimed at eliminating or suppressing homosexuality. The most important fact about these therapies is that they are based on the view of homosexuality that has been rejected by all major mental health professions. The Diagnostic and Statistical Manual of Mental Disorders, published by the American Psychiatric Association, which defines the standard of the field, does not include homosexuality. All other major health professional organizations have supported the American Psychiatric Association in its declassification of homosexuality as a mental disorder in 1973. Thus, the idea that homosexuality is a mental disorder or that the emergence of same-sex attraction and orientation among some adolescents is in any way abnormal or mentally unhealthy has no support among any mainstream health and mental health professional organizations. Despite the general consensus of major medical health and mental health professionals that both heterosexuality and homosexuality are normal expressions of human sexuality, efforts to change sexual orientation through therapy have been adopted by some political and religious organizations and aggressively promoted to the public. However, such efforts have serious potential to harm young people because they present the view that the sexual orientation of lesbian, gay, and bisexual youth is a mental illness or disorder, and they often frame the inability to change one's sexual orientation as a personal and moral failure. Because of the aggressive promotion of efforts to change sexual orientation through therapy, a number of medical health and mental health professional organizations have issued public statements about the dangers of this approach. The American Academy of Pediatrics, the American Counseling Association, the American Psychiatric Association, American Psychological Association, the American School Counselor Association, the National Association of School Psychologists, and the National Association of Social Workers, together representing more than 480,000 mental health professionals, have all taken the position that homosexuality is not a mental disorder and thus is not something that needs to be cured. The American Academy of Pediatrics advises youth that counseling may be helpful for you if you feel confused about your sexual identity. Avoid any treatment that claim to be able to change a person's sexual orientation or treatment ideas that see homosexuality as a sickness. The American Counseling Association adopted a resolution in 1998 stating that it opposes portrayals of lesbian, gay, and bisexual youth and adults as mentally ill due to their sexual orientation, and supports the dissemination of accurate information about sexual orientation, mental health, and appropriate interventions in order to counteract bias that is based on ignorance or unfounded beliefs about same-gender sexual orientation. Further, in April 1999, the ACA Governing Council adopted a position opposing the promotion of reparative therapy as a cure for individuals who are homosexual. In addition, ACA's Code of Ethics states, counselors use techniques, procedures, modalities that are grounded in theory and or have an empirical or scientific foundation. Counselors who do not must define the technique procedures as unproven or developing and explain the potential risks and ethical considerations of using such techniques, procedures, and take steps to protect clients from possible harm. The American Psychiatric Association, in its 2000 position statement on reparative therapy, states, psychotherapeutic modalities to convert or repair homosexuality are based on developmental theories whose scientific validity is questionable. Furthermore, anecdotal reports of cures are counterbalanced by accidental claims of psychological harm. In the last 4 decades, reparative therapists have not produced any rigorous scientific research to substantiate their claim of cure. Until there is such reasonable research available, the American Psychiatric Association recommends that ethical practitioners refrain from attempts to change individual sexual orientation, keeping in mind the medical dictum of first do no harm. The potential risks of reparative therapy are great, including depression, anxiety, and self-destructive behavior. Since therapist alignments with societal prejudice against homosexuality may reinforce self-hatred already experienced by the patient. Many patients who have undergone reparative therapy relate that they were inaccurately told that homosexuals are lonely, unhappy individuals who never achieve acceptance or satisfaction. The possibility that the person might achieve happiness and satisfaction in interpersonal relationships as a gay man or lesbian is not presented, nor are alternative approaches to dealing with the effects of social stigmatization discussed. Therefore, the American Psychiatric Association opposes any psychiatric treatment such as reparative or conversion therapy which is based upon the assumption that homosexuality per se is a mental disorder, or based upon the priori assumption that the patient should change his or her homosexual orientation. The American Psychological Association, in its 1997 resolution on appropriate therapeutic responses to sexual orientation, which is also endorsed by the National Association of School Psychologists, states that the American Psychological Association opposes portrayals of lesbian, gay, and bisexual youth and adults as mentally ill due to their sexual orientation and supports the dissemination of accurate information about sexual orientation and mental health and appropriate interventions in order to counteract bias that is based on ignorance or unfounded beliefs about sexual orientation. The American School Counselor Association, in its position statement on professional school counselors and lesbian, gay, bisexual, transgender, and questioning youth, states, lesbian, gay, bisexual, transgender, and questioning youth often begin to experience self-identification during their pre-adolescent or adolescent years, as do heterosexual youth. This developmental process are essential cognitive, emotional, and social activities, and although they may have an impact on student development and achievement, they are not a sign of illness, mental disorder, or emotional problems, nor do they necessarily signify sexual activity. It is not the role of the professional school counselor to attempt to change a student's sexual orientation or gender identity, but instead to provide support to LGBTQ students to promote student achievement and personal well-being. Recognizing that sexual orientation is not an illness and does not require treatment, professional school counselors may provide individual students planning or responsive services to LGBTQ students to promote self-acceptance, deal with social acceptance, understand issues related to coming out, including issues that families may face when a student goes through this process, and identify appropriate common resources. As these statements make clear, the nation's leading professional medical health and mental health organizations do not support efforts to change young people's sexual orientations through therapy and have raised serious concerns about the potential harm from such efforts. The National Association of Social Workers, in its policy statement on lesbian, gay, and bisexual issues, states that it endorses policies in both the public and private sectors that ensure non-discrimination, that are sensitive to the health and mental health needs of lesbian, gay, and bisexual people, and that promote an understanding of lesbian, gay, and bisexual cultures. Social stigmatization of lesbian, gay, and bisexual people is widespread and is a primary motivating factor in leading some people to seek sexual orientation changes. Sexual orientation conversion therapies assume that homosexual orientation is both pathological and freely chosen. No data demonstrates that reparative or conversion therapies are effective, and in fact, they may be harmful. NASW believes social workers have the responsibility to clients to explain the prevailing knowledge concerning sexual orientation and the lack of data reporting positive outcomes with reparative therapy. NASW discourages social workers from providing treatments designed to change sexual orientation or from referring practitioners or programs that claim to do so. NASW reaffirms its stance against reparative therapies and treatments designed to change sexual orientation or to refer practitioners or programs that claim to do so. As these statements make clear, the nation's leading professional medical health and mental health organizations do not support efforts to change young people's sexual orientation through therapy and have raised serious concerns about the potential harm from such efforts. Many of the professional associations listed in this resource section can provide help with information and local contact to assist school administrators, health and mental health professional educators, teachers, and parents in dealing with school controversies in their communities. And I will be posting a link for that in the community page. So, with the efforts to change sexual orientation through religious ministries, ex-gay ministry and transformational ministry are terms used to describe efforts by some religious individuals and organizations to change sexual orientation through religious ministries. These individuals and organizations tend to have negative attitudes towards homosexuality that are based in their particular religious perspectives. In general, efforts to change sexual orientation through religious ministries take the approach that sexual orientation can be changed through repentance and faith. In addition, some individuals and groups who promote efforts to change sexual orientation through therapy are also associated with religious perspectives that take a negative attitude towards homosexuality. Because ex-gay and transformational ministries usually characterize homosexuality as sinful or evil, Promotion in schools of such ministries or of therapies associated with such ministries would likely exacerbate the risk of marginalization, harassment, harm, and fear experienced by lesbian, gay, and bisexual students. In addition, the religious content of ministries and related therapies also raise legal issues which are addressed in just a moment. Okay, back at it. Public school officials are the targets of those who want to include information about efforts to change sexual orientation through therapy and religious ministries in the schools. In order to respond, public school officials should be aware of general legal principles concerning the rights of their lesbian, gay, and bisexual students. This awareness is important because of the risk that these treatments may cause harm to young people and of the potential legal liability for school districts and officials. A number of federal, state, and local laws and school district policies protect lesbian, gay, and bisexual students from discrimination, harassment, and similar harms. Two important principles from the U.S. Constitution apply to every public school in the country. They are A. The First Amendment, which includes the separation of church and state and the protection of freedom of speech, and B. The 14th Amendment, which includes the guarantee of equal treatment under the law for all people. The Establishment Clause of the First Amendment prohibits public schools from promoting, endorsing, or inhibiting religion or attempting to impose particular religious beliefs on students. For this reason, a public school counselor or teacher cannot tell the students or attempt to impose his or her religious beliefs about whether or not homosexuality is sinful. Because of the religious nature of ex-gay or transformational ministry endorsement or promotion of such ministry by officials or employees of a public school district in a school-related context would likely raise constitutional questions. Thus, schools should be careful to avoid discussions of transformational ministries in their curriculum. Apart from their obligation to avoid religious advocacy, public schools have considerable leeway in developing their curriculum. As long as the school's instructional activities does not inculcate a religious view about homosexuality, the choice of instructional materials about homosexuality does not infringe on freedom of religion. Public schools may determine, as part of their instructional activity, not to disseminate information to students when that information is not well-founded or is inadequately researched, scientifically unsound, or biased in some way. As the foregoing discussion of the concerns and policies of health and mental health professionals clearly illustrate, school officials should be deeply concerned about the validity and bias of materials or presentations that promote a change to a person's sexual orientation as a cure or suggest that being lesbian, gay, or bisexual is a sickness or mental illness. School officials routinely consider the views of professional experts in determining which educational and instructional materials to use in their schools, and in this case, those views strongly advise against any curriculum that suggests a therapy to change sexual orientation has scientific validity or that homosexuality is a disorder that should be cured. It is also important to note that the school's legal obligation under the Establishment Clause may be different when it creates a forum for outside speakers to present to students or when it invites students to speak about topics on their own. In those cases, depending on the individual context, schools, districts may not be able to forbid certain speakers who wish to express their viewpoints at such events. Lesbian, gay, and bisexual students, like all other students, are protected by the 14th Amendment and statutory requirements of equal treatment under the law. The Supreme Court has made clear that under the 14th Amendment guarantee of equal protections under the law, public officials may not impose discriminatory burdens or unequal treatment on lesbian and gays because of public animosity toward them. In the public school setting, this means, among other things, that a school district must protect students from anti-gay harassment just as it protects students from other kinds of harassment. In 2003, a California school district paid $1.1 million to 6 students who alleged their classmates repeatedly harassed them because of their sexual orientation, and the school administration did not adequately address the harassment. Consistent with this mandate of equal treatment, schools should be careful to avoid curriculum choices that may single out and stigmatize lesbian, gay, and bisexual students and foster a disapproving attitude toward them. The legal mandate of equality for gay and non-gay students alike is not limited to circumstances of harassment. It applies to all decisions a public school official might make that would treat lesbian, gay, and bisexual students differently based on their sexual orientation. School officials should follow the law by ensuring that the factor of real or perceived sexual orientation does not result in a decision that treats those students differently from others. As an example, even outside the curricular setting, students have formed over 3,000 gay, straight alliances in school. The Federal Equal Access Act requires secondary schools to treat the gay-straight alliance the same as any other non-curricular related student club allowed to meet on campus. These general legal principles, supplemented by consultation with the school's legal counsel, should be helpful in the important and sometimes difficult decisions that educators must make in order to serve all students, including those that are lesbian, gay, and bisexual. Have a good day, everybody.